Hi everyone, my name is Haley Morgan. I am a student at Washburn University in their Occupational Therapy Assistant program. I'm currently in my second rotation of Level 2 fieldwork. I am at Ascension St. John's Hospital in Bartlesville, Oklahoma. And some of the setting and patients that we see, we're on the rehab floor, so a lot of ortho patients, total knees, total hips, amputations, things like that, strokes. We're also on the psych floor, so I'm seeing a lot of psych patients, the acute floor, the CCU, all kinds of diagnoses. So basically, I'm going to present my in-service project for the second rotation, and I'm going to go ahead and share my screen to show you guys what it looks like. So here it is. It is called your playing card matching game. Pretty self-explanatory, very cheap to set up, not a whole lot of money spent, very easy to set up. But basically what it is just an over-the-door shoe organizer and then a set of playing cards. And essentially the concept of the game is to put, you as the therapist would put cards in each slot and then give your patient another set of playing cards. And basically as the game goes is you just tell them whatever's on the top of the deck, you try and scan going from left to right on the top row and then going down and so forth and trying to find the match. If they find the match, then they just put that card in there. So pretty easy, but some of the benefits of this activity, you can grade it up or down really easy as a therapist. You can make it a little bit more difficult. If it's too difficult for this patient, then grade it down, make it a little bit easier for them. It works on their dynamic standing balance, being able to have to move their balance a little bit to reach onto one side rather than the other. It works on their range of motion, reaching high, reaching low, crossing midline, things like that. Works on their fine motor skills, being able to hold that playing card and putting it into the slot. Works on visual scanning, like I said earlier, starting at the top, going left to right, making sure they're looking at every single slot. Like I said earlier again, works on reaching high and low, works on sequencing as far as telling them the directions of the game. You can tell them the directions all at once, or if they aren't doing as well for sequencing, giving them step-by-step instructions. It works on problem solving. It works on their standing tolerance, being able to stand up for long periods of time. You could start by just standing for one row at the top, then sitting down, taking a break, and then standing up and moving on to the second row, and then build their tolerance up to being able to stand the entire activity. It works on their functional reaching, and it also works on their gross motor coordination. And like I said earlier, I feel like this can work for almost any diagnoses. I've used this a lot on our rehab floor. Like I said earlier, we have a lot of stroke patients, a lot of total hips, total knees, shoulder surgeries, and then also amputees. So I feel like this could work again for any rehab patient, but also acute care, psych, whatever the diagnosis may be. Some ways that you can grade up the activity, you can use a foam balance cushion, have them stand on that to kind of off kilter their balance, and have them use their core and their legs and everything to continue to stand up as they're reaching for that slot. You can have them go up on a stair step while placing the card, having them be able to lift their leg up to a certain threshold, stepping on it and then placing it. And then only using the top or bottom row to really work on that reaching high and reaching low aspect. And then some ways to grade that activity down, you could do it seated. Like I said earlier, you could do one row, then sit, take a break, work on the next row, or you could have them sitting throughout the whole activity and only doing about these 3 rows right here, instead of doing the higher and the low ones. You could do one row at a time, or you could do spot the difference between 2 cards. So only putting 2 cards up and then having them do it that way. But that's basically it. Again, it was really cost effective, not a whole lot of money spent. It's very easy to set up. It probably takes a minute to set the whole thing up. This activity its home is on our rehab floor in the gym, but I've taken it, like I said, to the psych ward, acute care floor, it can go anywhere. It can just fit in a little bag and it's ready to go. But that's basically my project. I hope you guys enjoyed it.